medication they're on and if they're on an oxygen therapy device. Some indications for an LVN is that they have a bypassed upper airway and they're not receiving proper humidification moisture exchange, and they have dry secretions. Some contraindications are that they have hyperresponsiveness in their upper airway, which can lead to bronchospasms. You also want to check what their chief complaint is also to know why you're giving them this treatment. So before you go in, you want to make sure that all your equipment is ready. So you have your stethoscope, your pulse ox, you have the LVN, you have your correlated tubing, your water trap, and then the aerosol mask. So before you go in, you want to just make sure you get 3 ml of hand sanitizer, or you can wash your hands. You just want to rub it in for at least 15 seconds or until it's all dissolved. And you want to just go ahead and put on your gloves. And then you can go into your patient's room. Yes, can I come in? Sure. Hi, my name is Diana Sedania, and I'm a respiratory student at Hartnell College. Can I get your name and date of birth?
Sure, Mickey Lisa, 92782.
Thank you. Can I see your wristband?
Sure.
All right, perfect. So how are you feeling today?
Feeling some secretions.
Yeah, so I'm giving you a large volume nebulizer to help those secretions move up so you can cough them out and clear your airways, okay?
Okay.
All right, so before that, is it okay if I take some vitals real quick?
Sure.
All right, so I'm just going to take your oxygen saturation. Can I put this on your index finger? Thank you. And then I'm just going to go ahead and take your pulse rate, okay?
Okay.
Right, so all your levels are good in range, in normal range, okay? So is it okay if I'm gonna just listen to your lungs really quick and see if what's going on in there? Is it okay if you can just roll over for me?
Sure.
Do you need help assisting?
No, to the side.
Yes. So I'm gonna go ahead and start with the bottom of your lungs, and every time you feel my stethoscope, just go ahead and take a breath in, okay?
Okay.
Go ahead and roll back over for me. Thank you. And then is it okay if I check the front of your
Sure.
chest as well? I'm just going to unsnap it and then I'll snap it back. Okay. I'm just going to check your neck as well. Perfect. And you look normal, though you're not having any cyanosis or anything, okay?
Okay.
All right, and then so what I'm going to do is just give you your large volume nebulizer, and you're just going to have it via a mask, okay?
Okay.
So I'm going to go ahead and attach it for you, and what the doctor had prescribed is an FiO2 of 30%, which is, I'm going to go ahead and put them to 5 to 8 liters, and it actually indicates it on the bottle right here. So you would just move this top orange part to 30, which would mean 30% of the FiO2. It's right there. And then you would just go ahead and thread this onto a millimeter, and you would want to make sure that you thread it properly so there's no leaks that happen. With this large volume nebulizer, the particle sizes are smaller to where it would go to the lower airways and it wouldn't just stay up at the upper airways. So you just go ahead and put the correlated tubing. You would want to make sure that it didn't touch the floor. If it it does, you would just want to get a new one. If this wasn't working, you can go ahead and grab a different one. And then you would put this correlated tubing with your water trap. And then you would attach your water trap to the railing. Attach the other correlated tubing. Attach it, or before you attach it to the mask, you want to go ahead and turn on. And set it to 6 liters per minute. And you just want to feel to make sure that the aerosol is out, and you can even put it to your shirt. When your shirt would get darker, making sure that the aerosol is through. And you would go ahead and just attach it to the mask. And then put it on your patient. Is that okay for you? Then you just want to make sure that the tubing is down, at the bag is down, so that way the water can just trap in there, and there wouldn't be any bacteria that would build up with the condensation or anything. So you want to go, after 15 minutes, you want to go ahead and assess again. So you would just take their oxygen saturation. Is it okay if I take your oxygen saturation? The treatment's still going. Index finger, please. And I'm just going to go ahead and take your pulse rate again, okay? Alright, your levels are still looking good. Do you feel a little bit better? Do you feel the secretion starting to come up? Alright. And then I'm actually just, can I check the front of your chest again? Just gonna unsnap the front one, and then I'll snap it back when I'm done, okay? Okay, and every time you feel my stethoscope, you're just going to take a breath in. Just repeat one more time. Alright, so I'm gonna, as you continue to do your treatment, I'm just gonna leave you with a tissue, so in case you need to cough, you can just cough into the paper towel, okay? And you wanna check the sputum production and see like the odor, the color, the consistency, to see if there's any infection going on or anything that's going on with the secretions. Okay, do you have any questions for me? Okay, I'll go ahead and check back with you, okay?
Thank you.
So you would exit the patient's room, take off your gloves, dispose of them, get 3 mLs of hand sanitizer again, rub it in your hand, and then you would want to document. So you want to document the pre and post vital signs. You wanted to document their skin color to see if if they were a little blue at the beginning, and see if they're getting better. You would also want to see the sputum production that they have, if they have any. You want to see if they had any chief complaints and what their trends are for their vital signs. So thank you for watching.